Good afternoon, everyone. I would like to welcome you to the 12-month progress report on my PhD thesis, which focusing on assessing the efficacy and safety of proton pump inhibitors. My name is Elena. I'm a second-year resident doctor in gastroenterology and a PhD student here in the Center for Translational Medicine and at Grigore Popa University of Medicine and Pharmacy, Iași. And together with my team, my two supervisors, Balint Eros and Vasile Liviu-Drug, my SMS Mahmoud Obeidat, and our statistician Dani Vereș, our vision is to improve the clinical management of patients suffering from gastroesophageal reflux disease. We plan to do that by assessing the efficacy and safety of acid-suppressive drugs. For this, we have two specific goals. The first project aims to investigate the therapeutic effects of acid-suppressive drugs in the treatment of non-specific chronic cough, whereas the second project looks at the risk of Clostridioides difficile infection in adults with PPI treatment, both systematic reviews and meta-analyses. Allow me to discuss our first project in a bit more detail. As we all know, the Montreal Consensus recognizes chronic cough as a potential form of extradigestive gastroesophageal reflux disease. It has a high global prevalence of up to 9.6% and is considered to be a significant cause of quality of life impairment. Acid-suppressive drugs have been proposed as a potential therapeutic option. However, over the years, studies have yielded inconsistent results. Therefore, our aim is to assess the effect of acid-suppressive drugs in patients with non-specific chronic cough. For this, we employed the PICO framework, our population being adults with non-specific chronic cough. Our intervention of interest is acid-suppressive drugs compared to placebo, and we're looking at the impact on cough severity and quality of life. And we hypothesize that there's a beneficial effect to acid-suppressive medications in patients with non-specific chronic cough. We have performed our systematic search on the 1st of November 2022 using this search key, which is comprised of three main domains. The first one is related to chronic cough, the second one to acid-suppressive medications, and the third one to the concept of randomization, as we only plan to include randomized controlled trials. You can see that following the Thailand abstract and full text selection, we have ended up with 11 eligible articles. Allow me to present some of our most impactful results. In this first figure, you can see the mean change in cough severity in patients with non-specific chronic cough receiving proton pump inhibitors compared to placebo. As previously mentioned, this is a very important topic because chronic cough has a high global prevalence and a significant impact on the quality of life of affected patients. Our measure of effect is the standardized mean difference, as the included articles assessed the severity of cough using various scales and questionnaires. As a tip for interpreting our results, you should know that a standardized mean difference between 0.2 and 0.5 is considered a relatively small clinical effect. A standardized mean difference between 0.5 and 0.8 is considered a moderate effect, and a standardized mean difference of more than 0.8 is considered a large effect. Our study has found a standardized mean difference of 0.33, which translates in a relatively small clinical effect, which is in our case also statistically proven. This data is derived from 9 randomized controlled trials, all double-blinded, which total somewhere around 350 patients. You can see that the population is rather homogeneous. We have a relatively low heterogeneity of only 16%, probably owing to the strict inclusion and exclusion criteria. So to sum up this first figure, we can say that there is some clinical benefit to administering proton pump inhibitors in patients with non-specific chronic cough in terms of reducing cough severity. We have also performed a subgroup analysis based on population category. We have 4 studies who looked at patients with chronic cough only, and 5 studies who look at patients with laryngopharyngeal reflux, which may manifest with chronic cough also. You can see that the symptomatic response is not statistically different between the two population subgroups. Additionally, we have performed a time dependency analysis to look at the relationship between treatment duration and symptomatic improvement. On the x-axis, you can see the treatment duration in weeks, and on the y-axis, you can see the symptomatic improvement as represented by the standardized mean difference, And you can see that there's no association between longer treatment duration and a more marked symptomatic improvement. One of the main strengths of our first project is the fact that we looked at the effect of PPIs on both cough severity and quality of life, and we also provided additional insights by means of subgroup analysis and time dependency analyses. We have, of course, followed a very rigorous methodological approach, and we have a very homogeneous study design, as we also only included randomized controlled trials. There are a few limitations as well, probably the most important one being the relatively small number of included patients, and also the fact that all measurement of outcomes was entirely subjective, using varying scales and questionnaires, not all of which were validated. In conclusion, we can say that treatment with PPI can result in some modest symptomatic improvement in patients with non-specific chronic cough, and that this effect does not seem to be dependent on the duration of administration. In clinical practice, that means that this could be beneficial in selected patients and that there's no benefit from extended treatment durations. In terms of implications for future research, we suggest that further RCTs be conducted with appropriate sample sizes and objective cough measurement techniques. And also we could look at other newer, possibly more potent acid suppressors, such as potassium-competitive acid blockers. Here you can see the current status of our first project. It is currently under review with the American Journal of Gastroenterology since the 30th of July. Some words about our second topic as well. As we all know, the proton pump inhibitors are among the most widely prescribed medications worldwide, which with recent estimates from Spain saying that 1 in 10 people is actually a daily PPI user. An increased risk of Clostridioides difficile infection has been described in PPI users with an up to 2-fold higher odds compared to non-users. However, we should bear in mind that these data only come from observational studies and could be the result of confounding and other biases. Therefore, our aim would be to assess the risk of Clostridioides difficile infection in adults with PPI treatment, but in the context of randomized controlled trials. For this, we also use the PICO framework. Our population of interest is just adults, and the intervention we're looking for is proton pump inhibitor treatment compared to no proton pump inhibitor treatment. And our main outcome of interest is the rates of Clostridioides difficile infection. Additionally, we're looking at other enteric infection and the small intestinal bacterial overgrowth, and we hypothesized that there's no increased risk of Clostridioides difficile infection in patients with PPI treatment, therefore evaluating the safety profile of PPIs. We have performed our systematic search on the 2nd of March 2023 using a search kit that was comprised of 2 main domains. The first one is related to proton pump inhibitors and the second one to the concept of randomization. And you can see that following the title and abstract and full text assessment, we have ended up with 17 eligible articles. Here you can see our current status of the second project. It is in the data extraction phase, which is estimated to be done by next week. Therefore, a short summary of our 2 projects. The first one is currently under review with the American Journal of Gastroenterology, and the second one is estimated to be ready for its first submission somewhere around November 2023. I would like to thank you for your attention and leave you with a quote that says that a smooth sea never made a skilled sailor. Thank you.
I would like to ask about the second topic. I would be really interested in subgroups for indication for PP, if there would be some difference. Do you plan to include this in your study? And if so, if there are some preliminary data you can probably share.
Thank you for your question. Yes, we have planned a lot of different subgroups. We have also mentioned them in our Prospero registration. So we have subgroups based on indication for the PPI treatment, based on duration of PPI treatment, means of administration, whether it's oral or intravenous, basically based on a lot of different potential subgroups. So yes, we have thought of that. We're taking that into account. As of now, we don't have any preliminary data yet. We're still extracting the data, but we hope it will be available soon.
for how long would you prescribe the PPI for your patients, taking into consideration your research?
So, as you've seen from the time dependency plot, there's no significant benefit that can be seen with longer treatment duration. Currently, the guidelines suggest it should be administered somewhere between 8 to 12 weeks. So given our data, I would say if they don't respond to 8 weeks of treatment, there's probably not much use in prolonging the treatment duration to 12 weeks because there's probably a very low chance it's gonna result in symptomatic improvement. So I would say probably 8 weeks.
Did you have a chance to compare in your first study PPI versus like H2 receptor blockers? I didn't see those data.
Thank you for your question. That was the plan. As you could see in our research key, we included all acid suppressors. We were planning to look at H2 blockers as well. However, data is available only for PPIs. So that is why we could only compare PPIs to placebo.
Gastroesophageal symptoms are very difficult to treat in reflux disease, as part of your data are showing the same thing. Also a question, not only the duration of the drug, but the dose. Was there double dose of PPI or single dose of PPI in your research?
Thank you for your question. So out of the 11 studies that we included, 10 of them had double dose, just one of them had single dose. So most of them, yes, used double dose. We could not see a big difference between that study that used only a single dose and the others that had double dose, but most of them did have double dose.
So another important part of this topic, whether those patients were completely evaluated, whether those patients had pH monitoring before the PPI dose, or it was an unselected patient population. Since you have shown already with the pH monitoring, the reflux really coincides with the cough, you would expect much better results, I guess.
Yes, so thank you for your question. That's a very important comment. Due to the lack of time, I didn't present all our data. However, we did look at patients with pH-proven reflux. And only 3 studies with a very small number of patients included patients with pH-metry-proven reflux. However, because of the small number of patients, the results were not statistically significant. The standardized mean difference result was a bit higher, so the results seem to have been a bit better in terms of symptomatic improvement, but it was not statistically significant, probably due to the small number of patients. So 3 of them had patients with pH-metry, the others were just unselected. That excluded other etiologies of cough.
So you did 85% data extraction on the 11 studies you identified, 17 studies, sorry. Do you have any idea what is going to be the answer?
Thank you for your comment. So the very preliminary idea that I have is that there's no increased risk in the groups receiving PPIs compared to no PPIs. The numbers are very, very, very similar in the 2 arms of all the studies that we...
Tiny numbers, I assume.
Sorry?
Tiny numbers.
Tiny numbers, indeed, yes.